personal choices and take self-responsibility for their health. And so these are the kind of special guests we're going to have every week, so people get a little season.
New stuff.
And to
I
share,
love to
have an opportunity to share it with people that are watching the show, that are listening. You don't even have to really be watching us.
Right.
You go about your business and just keep the sound on and listen to this great information. That's exciting.
They'll find something valuable.
Yeah, exactly.
Well, let's have Dr. Karen join us.
Wonderful. I can't wait.
Dr. Karen, thank you so much for joining us today and telling us about all the wonderful opportunities for health that you offer both people and animals here in northern Arizona.
Thank you. I'm so excited to be here.
Well, thank you for joining us.
We're glad you're here. Yes.
So, we know that you started out with studying chiropractics and then never actually started practicing so much in that realm. Your life sort of veered off into a lot of different health options. Could you tell us just a little bit about yourself?
Sure, I can. I started actually my practice in Pennsylvania, in Bucks County, Pennsylvania, practicing network chiropractic, which was really, really fun, and it's a mind-body technique. So in a way, it's very extreme because it doesn't really use, or it can be used on many people who are not really chiropractic candidates. So I've worked with special education kids, autistic children, people on polio, folks who are in recovery for sexual abuse and alcohol abuse and all of that. And now, fast forward all these many years later, I still, people have titanium rods in their backs. And I also work on a lot of horses and a lot of animals as well, who nobody else can really help. So I kind of fit that little niche. But I've developed a technique that I only do that's kind of a mind-body technique, and it's just awesome. So
It sounds awesome. Can you tell us
a
little bit about that? Please?
Sure. It's a tapping technique that one of the things I really thought that I wanted to develop was a way to switch our nervous systems. And every mammal has two nervous systems that we live with, a sympathetic and a parasympathetic nervous system. And most of us are like, ooh, and that's the easy part. Ooh, is sympathetic nervous system. And more and more animals, too, are in that as well. The more stressed we become or the more we demand of them. So that kind of thing, when you're in one nervous system, you cannot be in the other one. And so I noticed that as people become more and more in pain, more and more stressed, that it's very, very difficult to switch those nervous systems.
And they get stuck in the sympathetic?
Yes. Basically, you can only have one nervous system turned on, and the other one is turned off. It's like a light switch. And so in our culture,
this is involuntary.
It is, exactly. Although you do have some control over it, but it is, yes. The sympathetic nervous system is fight or flight and pain.
Okay.
So if anyone is in pain, they are in that nervous system.
Okay.
And that nervous system in our kind of survival mode, if you're going to be eaten or you need to fight, there are certain things that you don't need. For example, you don't need digestion at that moment, right? So people sometimes who are having problems with constipation or things like that, sometimes they're in a sympathetic nervous system a lot, and basically the body starts shutting things down. It also turns things on, too. It turns the heart rate up. It turns the blood pressure up. So we have a lot of folks who are on blood pressure. Exactly. It turns the thyroid off. It turns the adrenals on. It turns heightened focus on, but only short term. What do I need to do next? What do I need to do next? So sometimes long-term, easy, peaceful things are very hard to do when you're in that nervous system.
To come by.
And we're all physiologically balanced. And when we get out of that balance, we go into the flight or fight syndrome. Is that correct?
Okay. And we were by design only, meant to use that. Certainly not even once a day, but we use it. There are estimates that most people are turning that nervous system on and promoting that sometimes more than 30 times a day. I think it's actually a lot more than that.
Well, it's our environment has a lot to do with it as well as our personal life, correct?
Exactly. And so the parasympathetic nervous system is this wonderful, healing, meditative place where you're peaceful, where you can take in bigger ideas, where you can think about someone other than yourself. In the horse. That's right. In the horse realm, and you can imagine if a horse is in a lot of pain, and then you put a rider on the back, often, that horse is just really trying to, deal with those kinds of things.
Yes.
As are we. So so that was the focus out of all of the hundreds and probably thousands now of patients that I've seen, again, animal and human, to really find a point of balance where the nervous system turned from sympathetic to parasympathetic, and where movement and the center becomes the primary focus. And no matter how, someone like JB, no matter how injured they are, that the body can start to heal, because it does not heal when you're in the sympathetic mode.
And does that particular technique also release the emotional trauma that's held within the body?
Yes, it does.
The memory of it?
Absolutely. And often, as you girls know, you must release that.
Right.
Sometimes you don't have to go back and revisit it for as long or as big, but you do need to release the imprint that it has on your energetic body, on your spiritual body, on your emotional body.
So the old saying, you need to go back so you can go forward.
Exactly.
And I think so
Very
many
true.
times that people are searching for this, but they don't even know where to start, really. So there's more of a science behind it, or there's more of an education that you've obviously learned to do this. So that's great, especially for the new year, to really start everybody get balanced.
That's right. This is my technique.
Right.
This is my technique. I developed this, and then more and more, again, just saw this niche, and that was, kind of from a long history of me being injured, in the past and kind of, working through that.
Working through those issues of your own.
Okay.
Would you rather work on a two-legged person or a four-legged person? Which ones are easier?
I think it's stunning personally that attention is given to our animals, because think of how, I don't want to use necessarily the word dependent, but how many gifts they give us, and a lot of times we don't think about their needs on an emotional or physical level unless we have an issue and we're just running to the vet.
And something other than being carried around in a little designer bag.
Yes.
That's right.
Well, it is interesting because the folks that I see that contact me, although I'm getting a broader and broader range, but it's people who are really, really sensitive, who often have rescued animals, and they know they have a past, horses or whatever, been starved or beaten or something like that, and they get to a point where they know they need something more, whether it's emotional or, again, spiritual or physical, where they see, a change in gait, or, they'll look at their back and they'll say, okay, something's going on here, or the whole other end, where I was saying I work on dogs? I do.
Cats?
And I worked on some exotics, and I'm hoping to work on more and more exotics as well.
Wow.
So anything that's a mammal, yes, that has a nervous system.
That's fascinating.
And I know you've done some specialty work with some specialty groups of horses.
I have. Currently I work with a big Olympus owner barn up in Washington, and they're just really very special, they're all special animals.
Right.
But yeah, I've been called up there to work, and I work currently, I've been doing more and more work with Jim Crew, who is Pat and Linda Peralte's only farrier, and he travels to Arizona, and I just recently traveled with him to California to the big Atwood Ranch, which is where a lot of Pat and Linda's horses, more Pat's horses are coming from.
That's amazing.
The evolution line.
I think it's great that you work with both. With humans and animals. It's amazing. And whatever you do, you are glowing health. You're centered and you're spiritual and you're everything. And
that's right. I was noting the same thing.
Yeah.
Noticing the same thing. You're really beautiful.
Oh,
kind of
thank
hooked
you
on
so
to all that.
Well, I feel uncomfortable without a ball cap. Depends if we're talking in the barn with a ball cap.
Have you been in our area for a while, Dr.
I have. I actually moved from the East Coast. I have this amazing story where I was driven off of a cliff, and I survived it without actually a bruise or a cut. And it was a 130-foot drop.
Wow.
And I went.
That is an amazing story.
I went to yes, exactly, angels, and I went back to my practice as I knew it, which was in the most affluent area in Bucks County. You've heard me say Jackie Onassis rode her horses up the street from where I lived, and I just didn't fit, and so I kept hearing "Go west." No. So I've been here, I think, just about 11 years now. But I do travel. I travel to Italy most every year, and I teach there. And yes. So this year we'll see. I think I'm going to spend most of the summer there.
Well, we're very blessed to have you as a resident of our community.
Teach in our area?
I do. And actually, I just recently taught a course on homeopathy for horse and rider.
Okay.
So since a lot of people trail ride, there's some nice things that you can bring with you, pack in a saddlebag for emergencies, snake bites and sunstroke and strains and sprains.
And you teach that?
I
you
do.
give courses. Wonderful. Yeah, we should all.
So, homeopathy is part of your practice.
Well, homeopathy, I teach homeopathy, yes.
Okay.
In Arizona, the licensure here is a little bit different than any other place, but I do try to help people. I do not diagnose, but I do try to teach people so they can be empowered, like doing here. Be empowered. So that when they go to the health food store, they can kind of say, okay, I know a little bit about this, and this is what I think I need. And homeopathy is awesome. Do you girls know a little bit about it?
Okay, and I see some
stuff. Yeah, you told me there's things you don't leave home without.
That's right. My purse and my backpack are always packed if I ever get thrown off a mountain again. Actually, when I thrown off the mountain, the angels left me with Rescue Remedy, which was interesting. All of my bags, all of my luggage, but save for one, which I had not packed my Rescue Remedy, and I threw it in a bag, and it was the only bag that
came with you.
That was left. All the other ones were in trees and and everything else. So Rescue Remedy is awesome. It is a flower essence, and a lot of people do or don't know about flower essences. Dr. Bach was a medical doctor 100 more, almost 200 years ago now.
Okay.
And he had the idea that all problems came from the emotions. And he also had this, again, we might call angels or some sort of divine intervention that told him that the dew off of flowers would heal people. And so he started collecting the dew and administering it to people, and he found huge changes emotionally for them. So Rescue Remedy is 5 of those flower essences, and this is their label. You can get Rescue Remedy by other people. I love this one. It's a spray, and you can also get it in a couple of other forms in a cream. And
Do you spray it in your mouth or on your body?
Yes, you can do anything.
Yeah. Oh.
You can do anything. As a matter of fact, I was at when I was in California at the Atwood Ranch. We had a horse and an owner who were getting more and more upset. Things were going on, and this horse was healing, and it was bringing out emotions in her. And I was like, one moment.
Let's help this out here.
There. And sometimes horses don't like, some horses like alcohol and some horses don't, especially if horses have been abused by someone who's a drinker. Sometimes they'll pull way far back.
Wow.
So what I did was I put a bunch of it, again, you can buy it in a dropper. I put a bunch of it in my hand and just slipped it underneath the horse who was, because the owner is becoming more upset and crying and all that, and to put it in my hand, and the horse just licked it and it was like
calm.
Wow. Transformation.
And I tried to give it to the owner. She's like, no, can't. I don't think so. But when the horse calmed down, she calmed down. Great.
I had it in drop form, liquid drop form, and there was a darling little dog I was taking care of for a while named Daisy.
Aww.
And when there was the oncoming of a storm, like most dogs, they go crazy, most animals, when a storm's approaching, but I mean, she practically had a heart attack. So I would take a few little drops of Rescue and put it in her water, calmed her right down.
And that's the great thing.
Am I hearing about this for the first time? I've never heard of this.
My dog Coffee needs this so bad.
Now we know.
as we can do.
That's right. And if anyone has a problem with the alcohol, you can put it in hot water and it burns the alcohol off. So for folks like in the past that I was treating who are alcoholic, sometimes that little bit of a, and it's only in there as a preservative.
Okay.
So,
Good to know.
That's very good to know.
Okay. I love learning new stuff.
Now, before we wind up your time with this, Dr. Karen, I need you to share with our viewers the unique thing that you did to put yourself through chiropractic college.
Oh, yeah.
Not fair. No. I put myself through chiropractic school doing singing telegrams.
Singing telegrams.
I have been.
Demonstration.
That's right. No,
I don't think I'll push her that far.
I have been, let's see, Wonder Woman, Dolly Parton. I was singing birthday cake. I've been, I got carried off at a plumber's convention as Mrs. Santa Claus. I was giving out awards, and the guy went, I don't want this award. I want Mrs. Santa Claus. I got carried off. And yes, I've been all kinds of things.
I think that's a
Great story.
You have been such a joy to have with us today. And before you depart, you know, we stress in this show a lot what raising glutathione levels can help with people's health, and not just people, but in animals also. Mm-hmm. And I know that you're just starting to partake in learning about that too. Do you have any words of wisdom you want to share with our viewers on?
I do.
Okay.
I think that there's, especially in this toxic, stress-filled, difficult world that we're in, anything that we can take that helps our body heal itself and also helps our bodies to metabolize whatever we're trying to in order to become healthy. And you know, this product, these things are just awesome. This product that's now, you know, coming to the fore with anti-aging, antioxidant, so much power, and that's what we need. So much power to balance all the things that are happening to us in our lives.
Well, one thing that the four of us really strongly believe in is taking personal responsibility for your own health.
We have to.
And that's a full circle. It is your emotions. It's not just your physical shape. It's your entire environment. And the work that you do so fits into the entire scheme of what people and animals have to look at to find balance in their life. So we can't thank you enough for coming and sharing yourself with us today.
Awesome.
Thank you very much.
We'd like to have you back.
Okay,
Dr.
guys, we'd
Karen.
love to
All
come
right.
back.
Thank you,
I'd love
Karen.
to come back.
Thank you
so
so
much.
Thank you, Dr.
All
Karen.
right, bye.
Appreciate it.
Thank you.
Don't you love it when you find somebody that has that amount of positive energy and joy that they can bring to you?
Amazing.
Like
Well,
you can
she's
just
glowing.
Amazing.
You can just see it
Absolutely
on her.
I can't wait to know her, to get to know her more.
I know.
You
I want to know her
more.
to.
Yeah, and I agree.
Yeah.
I think we need to have her back in the future. No
Absolutely.
question about us.
And we just scratched the surface.
We did.
On the talent,
Yeah.
really.
Mhm.
We
that
could have
this
done a whole
lady
show
has.
just on her. And
Yeah,
And we might.
and we
Maybe
might.
one of these days we
more
can
than a
just
show,
might.
a whole series.
Yeah. We could do a series on Dr. Karen.
Dr. Karen, medicine woman. Yeah, you could do that. Well,
Natural medicine woman.
yeah, the natural medicine woman, you're right. I'm excited.
Me too.
I'm excited.
Me
And
too.
she actually reminded me of a few things that I did know about, like the rescue remedy.
Mhm.
I did know about that, but you know, you use something for a little bit when you need it, and somebody
And you
tells
sort
you
of
about
forget about its
and then you
purpose.
forget.
Yeah.
And I have not had any around my house for quite a while now, and I'm going to go out and get some.
Well,
Oh, yeah.
your story about Daisy really impacted me because I have a Houdini dog who loves to escape, and whenever the
Right.
weather starts to shift,
Yes.
you better watch him because he's going to go, and he clears 6-foot fences really easy.
Yeah,
So I'm thinking this is going to be something good for me to try.
Daisy
Try
was
for
this
coffee.
Basset hound, and anyone who knows anything about Basset hounds, they're kind of hyper anyway, okay? Emotional kind of little dogs.
Mhm.
And she was more like a person. But honest to God, I would think she literally, her heart was going to jump out of her little body. But I've known of dogs that, I know of one anyway, that went through the window. The
my
big front, what do you call those windows that
Those
are in
picture
The
windows.
picture
Yes,
windows?
picture window. Went through a picture window during a thunderstorm. So having natural remedies around
Terrified.
is great
For
for all
such
of
a
us.
help.
Yeah, for all of
Well,
us.
we made a promise the last show that with this being after the beginning of the new year, when so many people are doing
Oh,
resolutions, that we
I
were going to
remember.
talk a little bit about weight.